Hello, everyone, and thank you for listening to IFFGD's COVID-19 program. Before we get started, I must mention that the information and resources shared during this podcast should not replace any medical care that you are currently receiving. It's important to always consult with your doctor and other healthcare providers before making decisions about your treatment. So today we have the pleasure of speaking with psychologist Helen Murray, who is a clinical fellow in psychology in the Department of Psychiatry at Massachusetts General Hospital. So Helen, can you actually share with us a little bit about what you do?
Oh, yeah, sure. I work with patients in the gastroenterology division at Mass General Hospital. Primarily work with adults, but also have worked with children and adolescents. And my primary area of research is in the intersection of feeding and eating disorders with gastrointestinal symptoms. So I work with experts in the feeding and eating disorders world, as well as medical professionals who do research in the gastroenterology world to try to help patients get better treated and get treated faster.
Oh, awesome. Thank you for sharing that with us. So, in our first podcast with Helen, we learned that during this pandemic, stress and anxiety can play a role in the illness experience for GI patients. We also learned about the impacts of stress and anxiety on the GI system. But today, psychologist Helen Murray will help us gain a better understanding of what stress related symptoms are and how we can manage them at home. So, Helen, can you briefly explain how stress impacts the GI system?
Yes, definitely. Stress is an evolutionarily adaptive response to any sort of threat to our system. And that can include external stressors, environmental stressors going around, like the stresses that comes along with COVID-19, including stay-at-home orders, those types of things. And so with stress, our bodies are wired to go into what's called a fight, flight, or freeze mode, or kind of a stress response mode. Specifically, it's our sympathetic nervous system that's responsible for this response. When people notice in their body during this response varies, but the general idea is that during this fight, flight, or freeze mode, your body tries to route blood to organs that need it most, which actually naturally produces GI sensations. Digestion is not an immediate necessary function during this fight, flight, or freeze mode. So some people might notice their heart rate increasing, the sensation of butterflies in their stomach, a loss of appetite, a change in bowel habits. These sensations are just warning signs or indicators of that stress response.
Yeah, so in knowing too the indicators of some of the responses to stress, um, the CDC actually just added GI symptoms to their official list of symptoms related to COVID-19. And can you speak a little bit about how maybe these symptoms of COVID-19 may be similar to symptoms that are related to stress, if they're similar or if they are different? Can you just kind of explain some of those symptoms related to COVID-19 and the symptoms that are related to stress?
Yeah, definitely. And I know that you all also had a podcast episode a couple weeks back with Dr. Brian Lacey. And so I'd encourage listeners to also listen back to that podcast episode where he describes things in a bit more detail. But COVID-19 has primarily been characterized by a fever, dry cough, difficulty breathing. But some reports have now suggested that digestive distress, including diarrhea and nausea, may be early signs of COVID-19. And as you mentioned, Haley, have been added to the list of symptoms related to COVID-19. So as I was mentioning with that stress response, digestive symptoms and sensations can occur when our body goes into that mode, that fight, flight, or freeze mode.
Right.
Thus, having symptoms of diarrhea and nausea are not in and of themselves indications of COVID-19. If symptoms like diarrhea and nausea persist, and or you develop a fever, extreme fatigue, difficulty breathing, those might be indications. And regardless, you can always contact a medical professional to see what advice they offer, to do a brief screening over the phone, or see if they think that it might make sense to come in for a visit.
Yeah, and that's a great point that you mentioned about the symptoms of like diarrhea or anything like that being persistent and continuing, that patients should possibly reach out to a healthcare provider to maybe run a test for COVID-19 or something like that, just to confirm if they do or do not have um, COVID-19 for sure. So, and part of that, can you explain now what GI symptoms commonly known to be mostly related to stress and anxiety?
Yeah, so with that stress response mode, it's interesting. We all experience slightly different things or perceive different sensation changes in when our body is under stress. But some people notice that they might experience some nausea or butterflies in their stomach, maybe some changes in their bowel habits, including sensations of abdominal cramping. And others also, especially when feeling anxious, might have a loss of appetite, and that could be associated with some of those symptoms too.
Yeah, that's really good to know, and knowing that these three are or some of the most commonly known symptoms for stress and anxiety. While we continue to face this pandemic and all the stress that many people may feel stemming from watching the news and just hearing about COVID-19, what techniques could our listeners practice at home to kind of help them cope with their GI symptoms that you just mentioned?
Yeah, so the first thing to know is that everyone has different ways of that they find are helpful to cope with stress. A lot of people, though, find that having multiple tools, so to speak, in their coping toolkit is helpful. So they aren't just relying always on one strategy, especially if that one strategy might not be something that's easily accessible right now.
Mm-hmm.
I often encourage my patients to write down a list of activities that include ones that go from short, like 1 to 2 minute activities, to longer tasks or projects they might be working on. But just simply, one thing that I recommend to everyone I see is a really accessible strategy that listeners might want to try out. It's called diaphragmatic breathing, or deep belly breathing is another name for it. And it's called diaphragmatic because in this type of breathing, you engage the diaphragm, a muscle that sits on top of your stomach. And this type of breathing can bring on your body's relaxation response because of the communication that this type of breathing will send via a big nerve that goes from your GI tract and up to your brain called the vagus nerve. And so the relaxation response that is brought on from this type of breathing is the opposite of that fight, flight, or freeze stress response. And so oftentimes it can be helpful to just use this type of deep belly breathing, even just practicing it for 5 minutes a day, maybe in the morning, maybe also doing it at night. And it's something that takes some practice to get the technique down for some people at first, but once you do, you really can use it at anywhere you are. So it's a really accessible tool. To learn how to do this type of belly breathing, there are lots of resources online if you search diaphragmatic breathing, including my psychogastroenterology colleague, Dr. Megan Reel from the University of Michigan, has a video online that can walk you through how to learn this technique.
Yeah, and that's a really good mention in there about Megan Real having a video, because sometimes maybe having a visual may also help people with understanding kind of sort of what the practice looks like.
Mm-hmm.
Because sometimes it can be difficult to understand, just it being verbalized. So that's a good tool that you mentioned. Um,
Yeah.
so, in other tools and resources, knowing that we have that one, what other resources might there be for patients to use to kind of help them with the techniques and practices that you're mentioning?
Yes, definitely. So, one great place to start is my colleagues at Mass General Hospital, actually, in the Department of Psychiatry, created a comprehensive guide on mental health resources for COVID-19, which is freely available. So, there are resources for everyone, from anyone in the community, medical professionals, whether you're dealing with just the stress around COVID-19, or maybe you're having trouble in other areas with more longstanding anxiety, depression, or other mental health concerns. So that's a great guide to sift through and see what resources are there, including many mobile app technologies that have evidence-based strategies for dealing with stress and anxiety, as well as other just online resources or resources to connect you to a professional.
Yeah, yeah. And we thank you guys at Mass Gen for helping us by providing a list of things that patients can do and how to help them get through some of the stress that is related to COVID-19. Because as many of us are experiencing the stress right now, just knowing that that is a free tool and guide is very helpful. So thanks to your team for having that type of resource available for a patient community.
Right. Yeah, I can't take the credit. So I'm very grateful too, because it's been a helpful resource for me to use and recommend to people. And there are many others out there, including many articles that are online. But I think it's a pretty great comprehensive guide.
Yeah. And throughout this podcast, you've kind of mentioned a little bit about some of the symptoms that may be related to stress and anxiety, such as nausea or bowel changes, abdominal cramping, and even loss of appetite. And you also kind of touched on some things that patients can do to help alleviate those or cope with, should I say, the GI symptoms, like writing down activities and even doing deep breathing exercises. Do you have any other advice that you would like to provide the listeners with at this time?
Yeah, I think that there are a couple other things that can be helpful to think about during this time. And one is that if you experience GI symptoms that could be related to stress you're experiencing right now, it can often be helpful to remember that they are warning signs of your body being under stress and not necessarily mean much more beyond that. Patients I work with often tell me that actually focusing on these symptoms can often make them feel worse. And kind of an alternative approach is by accepting the symptoms as temporary, even if they're uncomfortable, is helpful in coping with them so that they can focus on trying to do what they can to kind of engage and cope with things right now as much as possible. And so 3 general things that many of the listeners have probably already heard over these past couple of months, but 3 general things that I have been recommending to people are: 1, trying to establish some sort of routine or new normal routine, perhaps. Taking care of yourself with regular sleep and wake times, making sure that you're getting enough sleep for you, whatever that is. Eating at regular intervals throughout the day, even if you're not feeling as hungry related to stress, just making sure that you're eating at regular intervals to get your body what it needs. And incorporating some form of movement, even if it's just taking a brief walk outside if that's possible. The second is resetting expectations. So being compassionate with yourself right now. It may very well not be possible to be as productive right now, whatever that might look like for you. So being realistic about what you can accomplish is so important. And sometimes that means that maybe your expectations or things that you need to get done right now are actually lower than usual. So that might be resetting new expectations, new things for yourself that you might look for. And then the third is staying connected. I've really had to remind myself that social distancing is really physical distancing. So getting creative to stay socially connected with family and friends, or maybe even new people over the technology platforms that we have right now can be so important to keep that social connection. So those are just a couple of things that I think can be helpful to keep in mind. And as I've mentioned throughout, like everyone finds different strategies that work best for them. So coming up with what coping toolkit, what that looks like for you, can be a great start to just start building that toolkit.
Yeah, and I think you mentioned something that was really great of not really focusing all of your attention on the symptoms itself, but accepting that they are there and channeling that inner strength and realizing that you are capable, patients are capable of coping with some of those things that symptoms that may be related to the stress and anxiety that we're all experiencing. And then also, just like with the three things that you mentioned here at the end of setting a new routine and maybe resetting expectations and staying connected are all great things, I think, to keep in mind at this time. And we just want to say thank you to everyone who tuned in today to the COVID-19's program. And also, many thanks to psychologist Helen Murray for talking with us about managing GI illness stressors during this pandemic. So thank you. We're very, very grateful for you sharing your unique insights on this topic.
Yes, thanks for having me.
Thank you.